right now, Anthem is the only company that out of group insurers can do business with. Some people have looked at some of the mandates that were previously passed that scared away insurance companies because they couldn't be as profitable. Other people looked at we have a small state, so a lot of companies don't want to do business because we're small. And there are at least, I think they're looking at another 5 companies in the next 4 to 5 years that are going to come here. But what can you do to open up that market if you're reelected? Because it's a difficult market, especially next year with the ACA, and then everybody's going to have to be in something.
It was a difficult market, and we had a problem with Anthem being the only player involved. We've got 26 hospitals in the state of New Hampshire. Only 13, I believe, are covered by Anthem. Next year, we're going to have more, as you mentioned, 4 or 5 more health providers coming into the state that's going to open up those other 13 hospitals. I think it's working. I think Health and Human Services here in New Hampshire has done a wonderful job managing it. I think it's something we can point to with pride in the services we're providing to our citizens. And I think there's nothing legislatively that needs to be done, just the oversight of Health and Human Services and the program themselves, and look at the benefits that the new providers will give to the people in New Hampshire.
I mainly agree with Representative Shurtleff. However, our local hospital doesn't even take the Affordable Care Act. We're moving constituents that enrolled into the Affordable Care Act, and we're pushing them to the Elliott Health System. So when my opponent voted on the Affordable Care Act, I don't think he understood the implications of sending people that can't really afford the care already and making them go all the way to Manchester to afford important procedures. We need to make sure that healthcare stays local. It's the most local market in the entire world. And people like to keep their doctors. Individuals like to go to surgeons that they know. And you're losing that by making someone go somewhere else. So I would like to see that.
Yeah, I agree with Steve, and I think actually it's working. I mean, the good news is it's working, and we will have, I think, 5 new plans available through the exchange. Several of them cover all the hospitals in the state. So I expect to see costs come down because of the Affordable Care Act. I expect to see costs come down because of the Medicaid expansion. Let's be clear, the reason we expanded Medicaid was to save everybody in this room money. That's the reason we did it. Is to get the 20,000 people who used to have no health insurance and who would go to the emergency room, whether they could afford it or not, and get care that if they couldn't pay for it, we all would chip in and pay for their health care. People who say they don't like Medicaid expansion because they don't want to pay for other people's health care, you know, the sad news is you're already paying for their health care. And that getting them on Medicaid is a way to get them to be a little more proactive in their personal health care and cut everyone's